I'm really, really excited to have Katie online with me today. Dr. Katie Osteen is another physical therapist out in Virginia, and she's going to be sharing some really, really exciting information today about plantar fasciitis. And before we get started with all of the Q&As that we have lined up, Katie, can you share a little bit more about yourself and kind of your story and how you started specializing in plantar fasciitis?
Yeah, thank you so much, Sarah. Thank you so much for having me. And yes, so I'm a physical therapist. I have been in the field for 4 years. And the reason I started to specialize in plantar fasciitis is because in my first job as a physical therapist, I worked in a clinic that had a very close relationship with a podiatrist locally. And we were seeing tons and tons and tons of feet. And so there were multiple plantar fasciitis cases that I would get every single day. And so over time, I really grew in my skills to treat it and have developed a very great program that is sure to get relief. And so it became one of my favorite things to treat because I was so confident that I was going to be able to help those people and help them get results. And so through that, I started an online business where I'm able to help a larger scale of people resolve their pain through the internet. So that is a little bit of my background.
That's so exciting. And there's going to be so many people here that are going to learn so much from you today because of all that expertise that you have developed over this time. And it's really, really exciting because Katie and I actually chatted a little bit, and Katie plays a little bit of pickleball herself. So it's really exciting to have another healthcare provider that is specializing in this to be able to bring all of this knowledge, understanding the sport a little bit more too. Okay, so without further ado, let's jump right in. Katie, can you share some just general information and demographics on plantar fasciitis? Who gets it? How common is it? And what predisposes you to developing this plantar fasciitis?
Yes, absolutely. Plantar fasciitis is pretty common among adults. About 10% of adults will get plantar fasciitis at some point in our lifetime. And a few contributing factors, this is not an exhaustive list, but there are some more things that are not mentioned here, but being overweight or obese can be a contributor. Another one is also a sedentary person who is starting a brand new exercise program. So somebody who maybe hasn't been very active, but is all of a sudden starting to get into a walking program maybe, or a running program. Sometimes those people will start to develop it because of some weakness that has not been addressed. And then also people who are on their feet a lot during the day. So I see a lot of nurses and teachers, people that work out in an industrial facility, like a machine shop or something. Those people are very prone to getting it. And then also very active people, such as your audience. You guys are pickleball players, and so you're active and athletic. And as long as if you're the kind of person that doesn't believe in stretching and recovery, those people are a little bit more prone to getting plantar fasciitis as well.
Gotcha. So with that in mind, then, I know a lot of people will say, well, so how much stretching do you need to do? What stretches are good for you to do?
Yes, so that's a great question. And there are some things that you can do to, also, oops.
Looks like Instagram quit out on us real quick. Let me just go live again on Instagram and we'll be good to go. Okay. Give me just a moment, Facebook friends. We're getting our Instagram viewers some access as well. Here we go. Okay. So we got Katie back on Instagram too. Okay, so we were talking about how a lot of times plantar fasciitis can be caused by just not stretching or jumping into the sport. So we were going to start chatting about what kinds of stretches are actually helpful and how long you actually do need to stretch to make it effective.
Yes, that is such a great question. And I love it because that is the most proactive thing you can do to, number one, prevent plantar fasciitis, but also to treat it and avoid it from getting any worse. So the best stretches that you can do are calf stretches. So there are multiple ways to stretch your calves out, and I'd be happy to show you them in some of my programs. But stretching up against the wall with your leg back behind you, you can kind of lean forward and stretch out the calf. There's another stretch that you can do in a similar fashion with your back knee bending down to stretch out the lower part of the muscle, a different muscle in the calf as well. And then there's also hamstring stretches that would be very beneficial as well, because in the human body, the plantar fascia is the first, it's the lowest part of what we call the posterior chain, which is basically an interconnected system of muscles and fascia and tissue that goes up kind of the backside of our bodies. And so even stretching up at the hamstrings can make an impact down at the heel. Yeah. And so as far as frequency goes, you don't necessarily have to do this multiple times a day, but if you wanted to do a little bit of a warm-up exercise where you're getting your blood flow pumping and then doing the stretches and then going into activity, where whether that's playing pickleball or going for a run or a walk, and then you can also follow up with a few more stretches as well. So that would be kind of the ideal situation. Now, practicality comes in, and sometimes there's just not enough time for all of that. But especially for people that are currently in pain, I would say making it a priority is going to be the most important thing, because this thing does not just get better on its own, unfortunately. I wish we could sprinkle some pixie dust and see it all disappear, but that is just not the case. So just go into the stretching and the things that you need to do with the belief that consistency wins. And so that's my biggest piece of advice, is to commit and be devoted to the process and not expect super fast results from doing just a couple of stretches here and there.
Good to know. Yeah, I like that. Consistency is going to be what gets us those big wins. So for individuals who maybe aren't being super consistent, or maybe those who are kind of wondering if maybe they do have plantar fasciitis, what are some symptoms, common symptoms that they might feel either on the court or off the court?
Great question, Sarah. So the hallmark kind of classical sign of plantar fasciitis is morning heel pain. So if you're getting up and you're getting out of bed and those first few steps in the morning feel like a knife is stabbing you in the heel, that is kind of the most common thing you see in a plantar fasciitis diagnosis.
Okay.
It can also happen if you've been sitting for a long period of time, if you maybe took a drive somewhere or went to a movie, or you've just been relaxing on the couch and you notice those sharp heel pain after you get up. That is also another classical sign of plantar fasciitis. And then as far as the pickleball athlete goes, somebody with plantar fasciitis may have those things as well. You might also notice some pain or soreness during pickleball. And then you might also notice some more increased pain or soreness after you exercise.
Okay, gotcha. And so what is the reason why then, like after sitting for a long period of time, or first thing in the morning, why would that be so much more painful then compared to walking throughout the day?
Yes, that's a great question. So this leads us to talk about the anatomy of the foot. And so in our foot, we have a lot of muscles, a lot of bones, a lot of joints. The foot is very intricate and detailed. In the foot, there is a piece of tissue that we're all familiar with. It's called the plantar fascia. And it is a thick, fibrotic piece of tissue that's very tight and interconnected, and it originates on the inside of the heel bone. So if these are your heel, this is your heel and these are your toes, it would be kind of right in this general area where it originates, and then it fans out into all of the toes. And so this tissue is supposed to be tight. It's supposed to be very rigid because it's going to help keep you upright and create a rigid platform for you to be able to bear your weight while you're walking. But however, over time, sometimes the fascia can become injured. There can be tissue damage from one reason or another. And so whenever you see that morning heel pain, it's basically like, it's hard to explain, but sometimes it might be like little tears are happening in that tissue. And then it can just cause that increased pain right on that heel where the fascia originates. Now, when I say little tears, don't freak out. It's not like it's going to tear off and be very, very devastating. I mean, that could happen eventually if you had like a very rare, serious case of it. But these little micro tears are very common and also can happen in other parts of the body and things like that. But that is something that can contribute to that pain in the heel.
Gotcha. So it's not exactly sinister. It's kind of part of the process, but if unaddressed, then it can definitely build to something much, much more bigger and more painful.
Yes, that's very true.
Okay. So with that, then what are some common misconceptions or myths or, self-home treatments that you have seen people come in with that you would actually advise them not to do? And then on the other side of that, what would you recommend that they do instead in terms of home treatment?
Yes, such a good question. The most common piece of bad advice that I see and hear about is, oh, you have plantar fasciitis. All you have to do is stick a water bottle in your freezer and every morning take it out of the freezer and roll your foot on your frozen water bottle. That's all you have to do. That's it. And that is not good advice because there's so much more that needs to be done when you have plantar fasciitis. And ice, actually, I talk about this a little bit in my program, but ice is what we call a vasoconstrictor. So ice reduces the amount of blood flow that can come to an area. And with plantar fasciitis, a lot of times we need more blood flow to get to that fascia because it's already not getting a lot of blood flow because of the quality of the tissue. And so ice can actually make that blood flow decrease to the heel, which can just continue with that painful process. So I don't recommend icing it unless you're in a very inflamed state. And that's something I would like to talk to people about before I just say, never do ice, only do heat. That's kind of a case by case thing, but you should not just be icing your heel. There are so many things that need to be done, and it's impossible to share all of them in this short call, but the baseline is that you're going to need to mobilize the fascia. You've got to get that tissue to move. We've got to break up some of those adhesions and tightness in the fascia itself. We also need to strengthen the intrinsic muscles in the foot because they are usually very weak. And when you have a tear or fasciitis diagnosis, your foot needs support from those other muscles to be able to keep you upright and keep you moving. And so we need to strengthen those muscles. We also need to perform those stretches we've talked about. And then there's also, some other things that need to be done as well. So like I said, it's just a lot to say in a short video, but those are kind of the baseline things that I would recommend.
Gotcha. So just as a quick summary again for everybody that is tuning in, Katie was sharing that when you do have your symptoms, you don't necessarily need to just ice. You need to do a lot more than just icing. There are certain situations where icing is appropriate, but it is not a one size fits all sort of a treatment. Instead, you also need to be doing some stretching and some mobilizing and some strengthening. Strengthening is really, really important for making sure that you keep the muscle is strong and the fascia gets to respond appropriately. So with that, then I know how some people have said, okay, so with soft tissue mobilization and stuff like that, is that like just massage? Can I use a Theragun? Do I roll my ball, my foot on a like lacrosse ball? What kind of stretching home techniques that somebody might have access to at home that they could start on already?
Yes. So yes, Theraguns are very popular now. And I personally don't have experience using one on plantar fasciitis. So take whatever I'm saying here with a grain of salt. I typically prefer to use something that's a little more controllable, like the lacrosse ball, because with that, you're able to push as much weight as you want to onto that ball. The lacrosse ball is giving you that rigid surface to massage into the foot, into that plantar fascia to help work out any of those adhesions. A Theragun is a little more, you're not able to control it as much as far as I'm aware. Maybe you are, but if that's something that, people like, that's okay. I would just say, be careful not to, and would say this about the lacrosse ball or the Theragun or any kind of massage, be careful not to, do that technique over the really sharp, painful areas in the heel or in kind of the ball of the foot. You want to stay in more of the meaty part of the foot, because you don't necessarily want to push hard on bone, because it's not going anywhere. And especially if you have bone spurs, those can be really tender, and we don't want to aggravate them anymore with increasing pressure or blood flow to that area specifically.
Okay, so that's for the foot itself, but then you could also probably do some massage and some Theragunning to the calf muscles. That would be okay?
Absolutely, yes. Theragunning, foam rolling, all of it. Yes, the calves, the hamstrings, those would definitely be great techniques to introduce to just, number one, be a well-rounded athlete and a recovered athlete, but also to managing this pain.
Gotcha. So it sounds like a lot of that applies both if you've been dealing it for a while, as well as if it's pretty fresh, just working on those muscles and loosening them up, getting some strengthening and stretching into the calf muscles and the feet muscles, even if it's been a recent exacerbation or you just recently started feeling the symptoms. Is that a safe way to kind of take away what you've chatted about so far?
Yes, absolutely. I would say if you're a little more on the acute side and you may be having some like sharp, really sharp, tender pain, you're going to want to be a little more careful versus somebody that's, maybe you suffered from this for more than 6 months. Yours is more of a chronic issue at this point. And so you can be a little more aggressive with some of the techniques because the tissue is not as inflamed as it once was.
Good to know. Good to know. So then let's say, somebody has done some warm up exercises and before their pickleball game, should they be doing stretches as a warm up? Should they be doing certain strengthening exercises as a warm up? What actually would be the best warm up items to include, as well as what would be good to do on the tail end? Like, again, do they need to ice after they've played pickleball, or, what would be appropriate then?
Yeah, I would say it's for a good warm up, you want to do something functional. So whether you could run, like jog around a bit, maybe do some cutting drills where you're kind of jumping and stepping and shifting your weight, because I know you're going to be doing that during the pickleball game. And just to kind of get some blood flow before you get into a stretch is always an important part of a good warm-up routine. And then as far as like what specifically you can do, I would say you can definitely do some of those wall stretches just to elongate those muscles. But I would also encourage you to do maybe some heel raises just to get some blood flowing, get some good gastrocnemius contraction there, just to get it primed and ready to be ready to exercise and play in that pickleball sport. And then afterwards, if it's sore, if you're having a lot of pain, you can certainly ice it then. And then be sure and do all of those other good recovery methods like the lacrosse ball, the foam roll, the good stretching routine. And these are, like I said, this is just kind of a a method you can do as a healthy person. Now, somebody that's actively going through a really serious plantar fasciitis diagnosis, they're going to want to, have more specific instructions from a provider. But these are all things that a healthy adult can certainly do and implement.
Good to know. So, with the heel raises specifically, because I know this is something that I've also worked on with individuals, do you see a difference in how the knee is angled and how the legs are angled when doing heel raises? I know some people say, oh, do it with your knee straight, do it with your knee bent, do it with your toes pointed outward, do it with your toes pointing inward and facing straight forward. Is there actually a benefit to that?
Yeah, I mean, the different positions of the foot and ankle are going to target different areas in the calf. So if you're turning your toes in, I believe you're going to be working more of the inside part of the calf, and then the other way you would be working more on the outside of the calf. So yeah, I mean, you could certainly target all of that if you feel, like you want to. I personally don't recommend a specific position for calf raises in this kind of an instance, but it certainly couldn't hurt to kind of warm up every area and get everything firing.
Cool. Good to know. All right. So, with the individuals who have had plantar fasciitis or might be suspicious that they might develop it, are these exercises something that they're going to have to do like all the time for the rest of their life? Really working it out super hard and adding resistance to it?
No, definitely not, Sarah. A lot of the heart behind my program and my strategy is to get this knocked out and then to keep it away. Now, I will say, if you're not actively treating your plantar fasciitis with appropriate evidence-based resources and materials and methods, I don't know, like you may struggle longer than the person that does choose the right treatment approach. But no, if you are doing the right things and you are taking care of your heel and being consistent with it, the pain should and will resolve and go away. It's not something that really sticks around forever unless there's other things going on, which can happen. But for the most part, if it's just plantar fasciitis and you are doing the right things, it will leave you.
Good. That's really encouraging because a lot of people want to hear, oh, I'm not going to have to deal with this again, or I'm not stuck having to do this for the rest of my life. So that's really encouraging to hear. I noticed that in your treatment so far, you haven't said anything about injections. And I know that that is a very common question that comes up. So what is the evidence? What is the actual recommendation when it comes to injections for plantar fasciitis?
Yeah, excellent question. I'm glad you brought this up, Sarah. So, no, I mean, the evidence, steroid injections can help reduce pain. I mean, that is a fact.
Mm-hmm.
When you inject a corticosteroid into an inflamed tissue, that medicine is going to work to reduce inflammation. Now, what we don't know is and this is kind of case by case. Some people go get the shot and they are better for life. They don't ever have to go do anything else again. But for the majority of people, they do need to pair that treatment with a good stretching, mobilization, strengthening program, because usually the corticosteroid injection wears off after 10 to 15 days. So most of my clients and patients, after they get the shot, they come back and 2 weeks later, they're in the same exact position they were in. And so I really recommend, let's go ahead and do those things that we know you're going to need to do anyway. And sometimes the result is that you are going to resolve your symptoms without needing those medications. One other thing I'd like to mention, there is evidence that shows that repeated corticosteroid injections can actually reduce tendon strength over a period of time. So if you're consistently getting them every 3 months for years and years, that is not good for your overall health. And unfortunately, a lot of providers don't inform you of that, and they don't like necessarily warn you of that. So you just want to, my approach is always to, let's start with the movement-based approach, the more non-invasive approach. Show me how to move my body. Let's try to treat this with movement before we go into the medicine side. And so if that's something that's just my personal kind of method and belief. And I really like working with people that have that belief as well, because we tend to work better together because we both are looking for the same things. But yeah, so hope that answers that.
Yeah, no, absolutely. It kind of goes back to the same thing. It's a very reoccurring theme. There's no one treatment that will resolve everything. It's a combination and a variety of different approaches, of different treatments that actually make up what helps to treat plantar fasciitis. And at the end of the day, it's not necessarily something that, you are specifically predisposed to just because you're getting older. It just has to do a lot with your habits and your lifestyle and how quickly you jump into something versus ramping up into it. And same thing with all these exercises and stretches. It's not going to go away in one day. You have to ramp up into all the stretches and exercises and massage and everything. So that's good information to know, that, it is a cocktail of effective treatment. There's no one medication or one Band-Aid that's going to take care of it all. So good to know. So along that line, are there any other external tools? I know you mentioned foam rollers. We've talked about lacrosse balls and Theraguns, but are there any other external tools like footwear, insoles, specific other equipment that play a part into plantar fasciitis, either predisposing you or helping to treat it?
Yes, love this question. Yes, so I get a lot of questions about footwear. What kind of shoes should I be wearing with plantar fasciitis? Do I need this brand or whatever? And the best thing I can tell you is everyone's feet are incredibly unique. My feet are different from your feet. The way that my weight is accepted in my ankle is going to be different from you. And so it's really hard to make a sweeping recommendation about footwear whenever I am talking to a larger group of people. So what I can say though is that you are going to want to pick a shoe that is going to allow your toes to move freely in the shoe. I have a couple of examples here. So this shoe is a running shoe. The toe box, as you can see, is very curved and narrow. Now, our feet do not look like this inside of the shoe. The toes that we have, when your toes are in the shoe, they're going to be cramped up and pointed like this. And that's not natural for a foot. And so what that does is it actually discourages your toes from being engaged during activity, because your toes are not able to plant into the ground because they're cramped up in this tiny space. They're not able to really engage and be strengthened. So your body is relying more on your plantar fascia because your toes are not able to fully engage. And so when the plantar fascia is just getting stressed and strained over time, that can lead to that degeneration in the fascia itself. So I prefer a shoe, something like this. This has a much wider toe box that's going to allow all of your toes to lay flat in this toe box. So your toes can fully engage and plant into the ground. They're not cramped up into a pointed toe. And so this kind of a shoe is a much better choice to make. And this goes for all footwear, even everyday street shoes like sandals and things, flats. Something I can say to everyone is make sure you're picking a shoe that's going to allow your toes to have that free movement when you are walking, running, playing pickleball, whatever it may be. And I do want to mention that if you would like a custom kind of recommendation, I do offer a consultation where I can meet with you individually, and we'll share more about that later. But I would love to help you pick out your shoes it's just impossible to say, this is the shoe you need before seeing you and talking to you. So.
Good. That's really, really helpful. And again, it's the same thing. No one shoe is going to be the best for everybody. But I know that there's a lot of talk I've seen in some of the chat leading up to this event, as well as other conversations I've had. People have been talking about UFOs. Have you heard about UFOs or have anything to say about UFO footwear?
Yes, I have heard a lot of people love them. A lot of plantar fasciitis sufferers have found they're very comfortable for them. They have a nice cushy heel, and they come in a lot of different models, but I think the most popular are the sandal. It's a flip-flop kind of shoe. I believe Hoka has one similar. It's a recovery slide or recovery sandal. And so, yes, I will say, I'm not going to say that every single person with plantar fasciitis is going to love an UFOs shoe. And I do know some people that don't necessarily like them, but I will say the vast majority of people that I've talked to love them and are raving fans for UFOs because of that comfortable heel, especially people suffering with bone spurs. They're going to be very, light on that heel and not be aggravating that bone spur. But yeah, I've heard a lot of talk about them. I haven't tried them personally, but I have heard good things.
Yay, good. And that's encouraging, just so that people know that they can pull from some of these resources that do have good success, but they also can hear from a physical therapist who specializes with people that work with feet, also saying, yeah, it does work for people, and it's not just, a placebo effect, or, people are just trying to promote it, which is really, really good.
Yeah.
Along the lines again of equipment, we've talked about footwear and shoes. Can you talk a little bit about insoles, custom insoles, or orthotics?
Mm-hmm. Yes, absolutely. So another big question that I get as well. So orthotic is basically, if you want to think of an orthotic, it's really a splint, and a splint is a assistive device that's going to help support a joint. And so whenever you have a inflamed tissue, you do need a little bit of support and stability. And if you're not able to get that out of your shoe, then an orthotic might be the best next step for you. Now, there's a wide variety of types of orthotics, price points on orthotics, the custom ones being the most expensive. Those have to be custom made by a doctor. And so, and this is another one of those things that's incredibly personal to the person, to their feet. So again, it's hard to make a sweeping recommendation, but I will say that being in a supportive shoe is extremely important for somebody undergoing a plantar fasciitis or even an Achilles tendonitis kind of diagnosis, because that tissue is so inflamed and it is not, it's hurting. And so you've got to support around it and stabilize around it. But the goal should never be to kind of be in that orthotic forever, because we really want to heal the tissue. We want the foot itself to be stronger and more stable so that it doesn't have to rely on that splint or orthotic for the rest of your life. And so I would recommend, even if you do choose that, to have that be another piece of the puzzle in your recovery, make sure you are doing things to strengthen your foot along the way. Because over time, when you use that splint or an orthotic for a long period of time, it can, while you need it in the beginning, over time, it can just kind of keep you in that same position that you're in, because your foot's not getting any stronger, because you're basically splinting it, and just the orthotic is taking on the load more so than the foot. I hope that makes sense?
Yeah, absolutely. So it's kind of just almost like a brace. It's something that you have there to assist you, but it doesn't necessarily keep it away. It can kind of work with you in the meantime, but if you're not doing all the strengthening and stretching and working your own foot, then there's a possibility you could just become reliant on the orthotic potentially, if you're not addressing it outside of the shoe as well.
That's right.
Okay. Good. So just to summarize this so far from what we talked about with the footwear, so you definitely want something with a wider toe box, and you want to have something that your toes can lay flat and you can get good purchase on the actual sole of the shoe as well. And there's a lot of different types of shoes that this is actually beneficial for, not just your court shoes. This is for walking shoes too. And like you said, a lot of people have said UFUs have been really, really helpful for their plantar fasciitis symptoms. And you have pass that message along, saying that yes, if it's not the one shoe's gonna fit everybody, but there have been a lot of people that have benefited from UFUs. And then also with insoles and with custom insoles and orthotics and such, they can be helpful, but again, that's a case-by-case basis. You'd need to talk to a provider to figure out if that's indicated for you based off of that evaluation. And that's kind of going to be helpful for splinting and relieving some of that in the meantime, but you still need to be doing a bunch of other treatments. It's not a band-aid. It's not going to fix it and make everything better. So that's good to know. I did see a comment, somebody asking about compression socks. Do you recommend wearing compression socks during activities? Is there any insight or benefits to that?
Yeah, I would say, again, this is personal. Some people like the compression. Some people like it makes them want to jump out of their skin because it hurts. So again, it's personal, but I will say that it could help, especially with circulation. So as we age, our blood vessels can get a little bit weaker and they're not as efficient at pumping the blood in our legs specifically back up to the heart to get reoxygenated. And so, yes, a lot of people really like to wear the compression socks. It makes your foot feel a little more secure and stabilized. And then two, it's going to help with the circulation and just getting, especially if you have any kind of swelling or edema. I know a lot of healthcare providers wear compression stockings to work when they're standing up a lot during the day. So I will say, I mean, as far as when you're active and playing pickleball, make sure they're not too tight. You don't want to cut off the circulation, but yes, I think that could be helpful to just kind of keep that circulation pumping through the body.
Good to know. Okay, so again, to summarize kind of what we've been talking about so far is that plantar fasciitis is preventable. It's very, very common that it will come on if you have ramped up your activity, if you haven't been warming up and stretching out your calves, and if those muscles are also on the weaker side compared to what the activity level that you're doing. So the good news is very, very common that it will come on. My mic or my audio cut out for a second. So it's good to know that with these exercises, with these treatment of soft tissue mobilization and massage of the calf and gentle massage down at the plantar fascia, not over the bony prominences, and then doing strengthening exercises for the calf muscles, stretching it out using a foam roller or lacrosse ball or Theragun to help treat it on that. And then also doing the proper warm up before playing pickleball. Dynamic activities are better than just a straight stretch or hold. And then afterwards, if you are still having symptoms, and icing a little bit is okay, but don't let icing being the only thing that you're doing. And then when you're not on court and kind of in the mornings or throughout the rest of your day, just keeping those calf muscles stretched out and loose and doing some exercises to keep them stronger. But it's not something that you're going to have to do for the absolute rest of your life to the same extent, because you will be able to address those symptoms. And then as for footwear, you want something with a wide toe box. You want something that your feet can lay flat and you can get good traction into the sole. There's not necessarily, oh, this is actually bringing me back to a question I had. There's not really one brand that will be good for everybody, right? But are there certain brands that you have other than UFOs and Hokas? Are there other brands that you have seen people wearing with plantar fasciitis, or to kind of help make sure that they don't develop any symptoms?
Yeah, I will share a few brands that I know carry good options. So the shoe I showed, this is an ultra shoe. And so a lot of their models have that nice wide toe box that I really, really like. So definitely check out our ultras. You mentioned Hokas. I think Hokas are good, especially for the recovery period, because it gives you so much cushion in the sole. Another brand I'm familiar with and have heard good things about is Vionic. I know a lot of people really enjoy their brand of shoe, and but then after that point, everyone just has their preferences based on their activity and their shoe, their foot size and shape. So, but those brands I know definitely have good options.
Yay. That's exciting. And I know that's always helpful just to kind of have a couple of brands on your mind when you are out searching and looking. So yay, that's very, very helpful. And then going back again to the exercises, you wanted to be doing some toe curls, stuff that kind of work the intrinsic of your foot, as well as heel raises for your calf muscles, which is helpful. And there's not necessarily that you have to do every single angle and targeting all the areas, but it can be helpful if you do know that there's some weaknesses in those certain spots. And I know that there are some individuals who use a like a calf stretching device or machine. It kind of looks like a little arch that you rock back and forth on. Is that another tool that would be helpful or indicated? Was there any harm in using a tool like that to help stretch your calves using a rocker?
Yeah, no, I would say the harm could be involved. I think that's a great way to stretch the calves if you want an additional tool. You can, but just be sure you are standing with something you can support you, because it's one foot on the thing. And so you might need to make sure you're stabilized. And so you don't want to have a risk of falling there. But,
Yes.
but yes, the rocker is great. I've used those before. Slant boards are great. Just something kind of slanted up. These are all products that are in PT clinics, but you can also purchase them yourself if you want to. But I found that even just kind of stretching off the edge of a step is really good and kind of does the same thing. So, but yeah, if you want an additional product, then absolutely the rocker is great. A lot of people like.
Good to know. So with all this, we've talked about, what to do when plantar fasciitis does come on and who's predisposed to it. But from all of our conversation, it sounds like it is pretty preventable. So if you haven't developed it yet, what are the biggest takeaways from our conversation today for someone who hasn't developed plantar fasciitis? What can they do to try to stave it off as long as they can, or even, get rid of any chance of it coming on?
Yes, I love this question because I'm a firm believer that prevention is the best medicine.
Yes.
And I know you align with that too. We PTs are very big advocates for just healthy lifestyle and making sure you are doing everything that you can to be a healthy individual and be active. And so you don't have to deal with all these ailments and issues down the road. But so if you are someone that is not currently suffering from plantar fasciitis, or maybe you've had it in the past and you want to make sure it doesn't come back, my recommendation would be to, other than things that we've mentioned, the stretching, the mobilization, making sure your muscles are healthy and not overly tight, but also incorporating, and this would be advice for somebody that currently has it, but making sure you're very well hydrated. Muscles need fluid, they need electrolytes to contract efficiently, but also to relax efficiently. And so making sure you have a healthy amount of salt in your diet, as well as just a well-balanced diet in general, that's very important as well, just to make sure your body has all the nutrients that it needs to live optimally and prevent any issues from arising. Other things, just making sure you're choosing good footwear, avoid those pointy-toed shoes at all costs. And also be barefoot. Our body, our foot, a lot of people talk about arch support. Well, guess what? Your arch is the support of your foot. You don't necessarily, now this is not the case for somebody undergoing plantar fasciitis currently, but if you are a healthy adult, your arch is the support of your foot. It doesn't need more support. So be barefoot, go outside, walk in the grass, let your feet breathe and feel the ground that you're walking on. And so I do advocate for that. And then just making sure not to ignore strengthening in your foot and in your ankles. I know if you are an active adult, you are in the gym maybe a couple days a week, exercising your arms, your legs, but a lot of times we don't really think about our ankles and our feet. So just, adding maybe 5 minutes a day where you're doing some kind of toe strengthening exercises, some heel raises, some toe raises, and just not neglecting strengthening those muscles in your body.
Awesome. Yay. Go prevention.
Yeah.
So to all of you who haven't developed plantar fasciitis yet, you've got plenty of information to get ahead of it and make sure it doesn't come on. And for those of you who may be dealing with plantar fasciitis, I hope that a lot of this information has been helpful so far. We've covered so much, from therapy guns to footwear to stretching to the specific calf exercises and foot exercises that we can do. And so we've had so much good information. I'm going to go through the chat and the comments now and make sure that there are no other questions that have come up that we haven't covered already in our live today. We also talked about compression socks. We talked about approach stretch, rocker, calf stretch. Oh, somebody was asking about night splints. What is your input on night splits with plantar fasciitis?
Yeah, that's a good one. Night splints are, again, personal. I've seen some people with amazing results from a night splint. They wear it religiously every night to bed, and they claim that that is the thing that's really been the big difference maker for them. Other people claim that it makes them worse. So this is one of those things I don't personally make sweeping recommendations about, but if you are just curious to try it out, see how you feel in it. It's just, what it's going to do is essentially, while you're sleeping, normally when we sleep, our foot is kind of relaxed and our toes are pointed, but the night splint is it's got a strap that connects the toes up to your shin, and it's going to pull back on your foot while you're sleeping. So it's going to keep stretching that calf muscle through the night. And so, like I said, it can help, but some people really don't like it. So it's another one of those personal things. Make sure you have your receipt. If you don't like it, you can send it back. But yeah, it's one of those maybes.
Yeah, it's very common to just say you need to talk to someone to figure out what's going on specific for you, if kind of the general advice for stretching and strengthening and massaging isn't cutting it quite enough, which is, I mean, that makes sense because everybody's body is a little bit different. We all respond a little bit differently. So it only makes sense to talk to a healthcare provider that will be able to evaluate your feet for you. So that makes sense. So kind of to end with a last question, and then we'll finish up with some closing remarks, and I'll talk a little bit more about where you can find Katie. When it comes to all of this plantar fasciitis or any inflammation, how do you know it's cured, so to speak? Is it just, okay, the pain's gone, so that means it's done? Or is there kind of a milestone that we should be looking out for to make sure that we've been able to take care of it and we can go back to pickleball?
Yes, that's a great question. Usually I see some people that, they do a few stretches and things, and they get results. They start feeling better, maybe like 50 to 80% better. And so they think, oh, I'm better. I'm going to go back into all of my activities, and I'm just going to jump right back into pickleball or my running or what have you. And then they turn around and it can kind of come back. So I would say, as long as when are you cured? It's hard to know, but I mean, once you're not having that heel pain in the mornings, if you can get through an entire day without thinking about your feet, I would say that's a good sign. If you are, whatever the symptoms were that you were having, if they have started to go away to like maybe 5%, if you're like 95% symptom free, I would say you're safe to introduce more of your normal activity. I wouldn't say don't do anything until you're 95%, but before you go 100% back into like training for a marathon or playing pickleball every single day, just be wary, but also be sure to commit to the process, because that's the big thing that I see is when people get to 50 to 80%, they're like, oh, I'm okay. They kind of slack off on their plan, and then that's when we typically see it kind of coming back. And so you don't want that to happen. So just commit to the process. It shouldn't take more than 4 to 6 weeks, really. I mean, for a healthy adult with no other complications, 4 to 6 weeks is plenty of time for that plantar fasciitis to resolve. So that's kind of my take on that.
No, that's really, really helpful information. Yeah, kind of getting an idea of a timeline and the understanding of, oh, you don't have to cut out pickleball completely, just dial back the percentage of how much you're going into it, just to make sure you're not re-aggravating those symptoms. And once you're feeling good, that's more of a yellow light than a green light. It's saying, okay, make sure that you're still keeping on the plan to make sure that you get all the way out onto the courts without any other issues. So yay, that's awesome. I did see one other question here, and this will be the last question for today. Someone was asking about using TENS or EMS electrostim therapy. Is that indicated for plantar fasciitis, and does it help at all?
Yeah, that's a great question. So TENS is a form of therapy we use to help with pain modulation. So what it does is it sends electrical signals up to the brain. It overstimulates that pain center in your brain that interprets something is hurting. And so it essentially makes your body less sensitive to pain. So that's what a TENS unit does. It's not going to bring you healing. It's not going to reduce inflammation. There's a lot of misinformation about those kinds of therapies, but it can help with pain relief. So if you're in a point where you want to try that out, I would say it certainly can't hurt. And it can just be another drop in the bucket of kind of that, healing process. So yeah, you can just kind of put it on the sole of the foot. I've used it on patients before, and it can just kind of help give you some relief for the pain.
Awesome. Good. Well, thank you everybody for tuning in and for all of the great questions. Thank you, Katie, again, for bringing such valuable knowledge and specifying it to pickleball players so that we can take from it and apply it to our play, both on the courts and as well as our care off the courts. So for everybody that's been tuning in, you can find Katie, her whole social media and Instagram and Facebook is all about plantar fasciitis. So if you have more questions, follow her on Instagram at Katie Osteen, Osteen, with an underscore at the end of it. You can find her Facebook page, and also Katie Osteen. It's a health and wellness page. She also has a website that is Dr. Katie Osteen. That's doctor spelled out, Katie Osteen. And you can find so much great information about her program, the Plantar Fasciitis Fix. And she's also, for any of you who may have osteoarthritis or know somebody with osteoarthritis, she did a really fantastic podcast and conversation with Dr. Amanda Kuhn. She's another physical therapist who specializes in osteoarthritis. You can find that on YouTube. You can search Katie or Amanda Kuhn, Kuhn. So you can just keep getting more and more great knowledge from Katie and learn more about how to take care of yourself when you're playing pickleball. Katie, in these last moments, can you share any other things about your Plantar Fasciitis Fix program and your coaching calls?
Awesome. Yes, I'd love to. So I created a 30-day program for the active adult who is suffering from plantar fasciitis, and it is kind of a one-stop shop. You're going to get 30 days of evidence-based exercises delivered straight to your email address every single day. They're all in video format, so it's very easy. You just click play and you just start on your daily routine. Each day's task is no longer than 15 to 20 minutes a day. And so I created this so that people could skip the waiting rooms, get immediate access to relief, and also save some money in the meantime, because we all know that healthcare can be expensive. And then I do offer support through the program. During the 30 days, there's an option to work with me one-on-one if you want a little more hands-on assistance as well. And so I also, available to you during that time, just to make your life easier and answer any questions that they have during the program. But the goal is to get you pain-free in 30 days. And I do have a guarantee as well. So if that doesn't happen for you, it's a no risk money back guarantee for you. So that is there as well. So yeah, we've helped a lot of people get back to walking pain-free. Haven't had any pickleball players yet, so would love to add some of them to the mix.
Absolutely.
Sure.
And her social media is chock full of so much great plantar fasciitis information and really great testimonials. I'm really excited for you guys to have Katie introduced to your worlds. Please go follow her. And for those of you who maybe didn't catch the whole thing or who knows somebody who might benefit from this, we will be posting this video. It's recorded, and we will be posting it onto Facebook. I'll also be uploading it to the Phase Physical Therapy and Wellness YouTube. And if you want to get notified when that video does go live, I'm going to be posting a link into the Facebook event page that we are streaming live from, so that you guys can get notified as soon as it goes live. But thank you guys again so much. Give a round of applause wherever you're at for Dr. Katie Osteen. Thank you so much, Katie. And I look forward to chatting with you again, because I'm sure more questions will come up now that we've got our basic beginner information. So have a good rest of your day, Katie. Thank you.
Yes, thank you so much, Sarah. Just a pleasure talking with you as always.